Pain will be managed after the surgery with local anesthetic. In addition, you'll be given an infusion of pain medication prior to being discharged from the recovery room. You'll go home with a oral pain medication that is a narcotic to help with postoperative pain. After 1 to 2 days, an anti-inflammatory non-steroidal medication can also be taken and added to with weaning of the narcotic. Hopefully, postoperatively swelling will be minimal after the placement of a sling. Sometimes you might have some swelling in the scrotum. Ice packs and support, so whether it be tight-fitting underwear or scrotal support, can be utilized to help decrease swelling. The incision site usually can be washed with soap and water the day following the surgery. Usually a surgical glue is placed over the incision. This will provide some barrier and hopeful sterility for the incision, so local care with normal bathing will be applicable. I usually remove the catheter approximately 48 hours after surgery. We usually have you come to the office and we check on you, ensure your postoperative pain is managed, that there's no unexpected events or outcomes, and the catheter is removed at that time. We usually have you avoid taking submerged baths for about a week after the surgery. You can shower starting the next day, soap and water and pat dry. No special care for the incision. The biggest limitation after the surgery is heavy lifting or straining in activity. Generally for 4 weeks, we recommend no heavy lifting, straining, and if possible, squatting, sexual activity, or exercise, other than walking. You can drive after the surgery once you are no longer taking narcotic pain medication. So potentially you could even drive as soon as the next day after surgery, depending on your level of postoperative pain. You are able to return to work once you're able to do your job. If you have heavy lifting, straining, or activity and are unable to have light duty, then it potentially could be 4 weeks. If you're able to do a desk job or have jobs where you have no heavy lifting or straining or squatting, you likely could return to work even as soon as a week post-operatively. I generally tell people for moderate level of work that don't involve real heavy lifting, straining, or activity, they usually are safe to go back to work somewhere around 2 weeks. Typical recovery from placement of a sling is around 4 to 6 weeks. You should call our office after the placement of a sling if you are unable to urinate. You have severe swelling or pain that changes from after discharge. You begin to run a fever over 101. After your surgery, your postoperative appointments are usually made for you by the recovery room in most circumstances. This usually involves a follow-up in approximately 2 days to have the catheter removed in the office. In addition, we see you about 4 to 6 weeks postoperatively to assess your level of continence and also to provide any final clearances and release. Questions after the surgical procedure, you're happy to contact our office. We will return any messages or respond to any patient messages through the electronic medical record. If needed, we can allow for an urgent visit with one of the mid-level providers if I'm not in the office. We will try to address most questions via phone.